Hello everyone, myself Dr. Devendra Pal Singh. This is our 7th video on our YouTube channel completely dedicated to homeopathy, the voice of homeopathy. Today we will discuss a case of tubercular endobronchitis completely cured by homeopathy within 1 year. Now this is a special type of tuberculosis which occurs in the tracheobronchial tree, also known as EBTB, endobronchial tuberculosis. It is mainly diagnosed by the bronchoscopy and CT scan. Now, as soon as patient enters our clinic, our observation should start. The patient came to us was a fair complexion, lax and loose fibers, overweight, dwarfish, has a furry appearance of the tongue, red tip of the tongue, papillae erected, round tip of the nose and a round face. Now the present complaints of the patients were continuous cough from last 6 months, which was not responding to the traditional antibiotics and cough syrups. She had a dyspnea at night, palpitation on walking, easy perspiration on walking, respiration difficult in damp environment, and laziness. These were the present complaints what patient said as she enters our chamber. Now I dug more into the case. She was a 17-year-old girl, and I took the whole case taking and whole history and took some rubrics, and I'll try to show you what I perceived. Had pain from suppressed perspiration. First I took the particular rubrics. Fur-like appearance of the tongue, swelling of tonsils, external throat clothing aggravation, and on the abdomen also clothing aggravation, desire for loose clothes basically. Menses were late, about 5 to 10 days. Difficult respiration at night, which was mainly aggravated by lying. Now cough in tuberculous persons. Now this is a very important rubric in this case. We should not miss this one at least. Inflammation of bronchial tubes, chronic and inflammation of bronchioles. Palpitation of heart on walking. Heat of feet at night. Brittle nails, easily breakage of nails, and perspiration of palm, constant perspiration of the palm. Now when we move towards the generalities section of the case, there were dreams of some dead relatives, perspiration on slight exertion and walking, dwarfishness. I took the rubric dwarfishness. She was very short-heighted person. Complaints of lymphatic system. Now when I saw the report of the case, you can see in the CT scan it shows the calcified nodular opacities are seen in the bilateral hilar and subcranial regions, so suggested of calcified lymphadenopathy. And in the bronchoscopy it reveals clearly that tubercular endobronchitis was written by the physician. Now there was desire for bread, cheese, farinaceous food. There was aversion to milk and aversion to meat, special aversion. And there was some desire for eggs, but not specifically, but occasionally desire for eggs. Obesity in young people. She was a very obese kind of person. At the age of 17, her weight was above 75 and with a short stature of height. General summer season was aggravation. Now we took from generalities tuberculosis glandular of lymphatic glands. As we see in the reports, we see bilateral hilar subcranial calcified nodular opacities which are suggestive of calcified lymphadenopathy. So this rubric was important in the case tuberculosis, glandular lymphatic glands. Now, when we move to the mind section of the case, there was fear of dark, fear of high places, and desire for traveling. Now, this girl has constant fear that one day now she has to go for the TB hospital. She had to lie amongst the tuberculosis patients, and then she will develop the tuberculosis in the whole lungs, which is now located in the bronchioles and bronchial tree, but it will spread in the whole lungs. So this fear was there constant, that my disease will flare up more rapidly now after that. So I took the case, and the simillimum I got was from the repertorisation was calcarea carp, and also Vitholka system also suggested for tuberculinum, and I thought was if calcarea fails I will go for the anti-miasmatic treatment and taking the help of tuberculinum to cure the case. But the calcarea done it all, and all the work for cure was done by the calcarea. We didn't need tuberculinum in this case. So during 1 year of treatment, during this 1 year of treatment, calcarea carb was started from 200 potency and moved up to the 10 potency, and was repeated and given on several occasions as per the case was needed. Sometimes the cough flared up, then we had to repeat. Sometimes the case was having gone to a standstill position, then we have to repeat the dose, and at the end we have a little bit of again flaring up of the case, and at that time I took the decision for the 10 potency. Now after 10 potency everything changed, all the symptoms were gone, so I thought we should go for the MRI, CT scan of the case. And when you see the report of the case, when we again go for the CT scan of the thorax region, we have the normal study, shows the bilateral lung fields are normal, trachea is central and normal, no pleural effusion thickening present, no mediastinal lymph adenopathy seen, and impression was normal study. So when we started the case from calcified lymphadenopathy, and when we in the end of the case we see the normal study of the case. Now interesting point is calcarea also dissolved all the calcified lymph nodes. That I have not seen in the tuberculosis cases. Once some area is calcified, that doesn't go to the back to normal, but in this case we can see easily that calcified patches also gone back to the normalcy. So this was the case, and I also saw some rubrics in the NER repertory for the confirmation during the case taking, and there was cough with rattling in chest and tuberculosis, a very normal symptom, but in the proving of the calcarea carb it is written there in the guiding symptoms. In the stages and life constitution chapter we have fair, light complexion, grows too rapidly, and tuberculosis. Match our perfect scenario of our cases. Cough in night in the thighs. Now this was the first complaint, first symptom given by the patient. Now my Guruji told me that whenever patient comes to you, and what is his first words, first 5 or 10 lines are the most important. If those 5-10 lines, any of them you find in the NER repertory, never to leave that medicine, not to give it directly, but to think of it. So this was the whole case. I hope you like my video lecture on this case. Please write me in the comments about this case, and any doubt you have for the case, write on my email. And thank you all. I am working for a noble cause, and if you find my videos fruitful, please like them, share to your fellow homeopaths, and tell me what are your feedbacks. Thank you all homeopaths. Thank you.